I was diagnosed with acoustic neuroma in 2005. I had been experiencing some hearing loss, ringing in the ears, and some balance issues where I kept on veering off to one side. After a few visits to my family physician, he made a determination that I needed to go see an ear, nose, and throat specialist. While at the ENT, we had an audiology test performed where it was determined that I did indeed lose over 80% of my hearing on one side. Not knowing for sure what was causing this issue, he recommended that I go in and have an MRI performed. We scheduled that, and within a week had the results back where it was determined that I indeed had a 2.5 square centimeter benign brain tumor known as an acoustic neuroma. During the follow-up visit with the ear, nose, and throat specialist, he had initially recommended I have microsurgery performed. Not knowing what some of the other treatment options were, I went home, looked up as much information about acoustic neuromas as I possibly could, and found something called the Acoustic Neuroma Association. Had a wonderful website, great information about other individuals that had gone through this, and some of the other treatment options that were available. After reviewing the information on there, I found a treatment option that seemed a little more palatable to me called gamma knife radiation therapy. Also found a physician within the state of Wisconsin that would be able to perform this. So I scheduled an appointment with that individual, and after the initial consultation with him and the radiation oncologist, it was determined that based upon my tumor size of 2.5 centimeters and my age, I was a good candidate to receive the gamma knife radiation therapy. Weighing all of the pros and cons to each one, I decided that I was going to go ahead and get the gamma knife. We scheduled that treatment to be performed a few weeks later. Went in, showed up on a Friday morning and early morning, and waited in the surgical preparation room. They attached a halo to my head. Took another MRI to pinpoint the location of the tumor. Brought me into a radiation room where they performed the gamma knife radiation therapy. What this entailed was essentially similar to an MRI being performed, where you laid down on a table, they slid you inside a chamber, and you were dosed with radiation for maybe 10 or 15 minutes. You were slid back out, your head was repositioned, and you were treated again for another 10 or 15 minutes. This happened 3 times. After the final time, I was wheeled out, had another MRI performed after the halo was removed, sent downstairs, and within an hour after that, was on my way home. Whole process took maybe 4 or 5 hours. For follow-up activities at this point, what I did is I went back in for another follow-up MRI 6 months later, and then I scheduled one for each year after that. After year 5 of receiving MRIs, the determination was made that the tumor had actually begun to shrink in size. Very happy with the results from the gamma knife and everything that I had heard through the Acoustic Neuroma Association. So much so that I actually started up a support group down in Milwaukee to help other individuals that are diagnosed with the same type of tumor. Quality of life since then, I do still suffer from ringing in the ears. I do have hearing loss on the one side. But through attending some of these support group meetings and meeting some of the other professionals that come to speak at these meetings and some of the other patients, you learn a lot of coping mechanisms, how to deal with some of the issues, how to situate yourself in social situations, and how to compensate for the loss of hearing on the one side. Overall, very happy and productive, maintain full-time employment, participate in 2, sometimes 3 triathlons per year, and have a wonderful time with my 2 young sons. Overall, very, very happy with the choice I made to pursue the gamma knife radiation therapy. Best of luck.